Great. Hi, everyone. Thank you so much for joining us today. We'll wait for a couple of minutes as people join in before we start this. Great. If you could go to the next slide, please. Thank you. Hello, and welcome to the Cross-Cutting Youth Initiative for NTDs webinar, jointly hosted by the NTD NGO Network and the World Health Organization. My name is Subhino Tikari, and I work as a Programs Communication Officer for the Leprosy Mission based in Nepal. And through my work at the Leprosy Mission, I also chair the Communications Working Group of the NNN. And please do introduce yourself in the chat, which organization you're a part of and where you're from. And before we go deeper into the NNN and why we're here today, I would like to hand it over to my co-host, Ada from the WHO's NTD department. Over to you.
Hi, good morning, everyone. Thank you, Subin, and a warm welcome to everyone for joining us today on this exciting webinar on cross-cutting youth initiatives for NTDs. My name is Dr. Adeze Eze Ann, and I am currently a One Health and Neglected Tropical Diseases intern at the World Health Organization headquarters in Geneva, where I focus on zoonotic NTDs such as rabies, snake bites, tinea, foodborne trematodes, and echinococosis. Today, I am excited to co-host this session with Subin and to introduce our distinguished speakers. But first, let's hear from Dr. Gilbert Bayenda, Chair of the Neglected Tropical Disease NGO Network, the NNN. And he's also the global lead for Trachoma Advice for Fred Hollows Foundation. Gilbert will shed more light into the NNN's mission and critical role of cross-cutting collaboration. Gilbert, over to you.
Ladies and gentlemen, friends, colleagues, welcome. My name is Dr. Gilbert Bayenda, and I am the chairman of the Neglected Tropical Diseases NGO Network, popularly known as the NNN. Now, for nearly 15 years, this network has stood as a global force, uniting NGOs, amplifying voices, and driving action to liberate over 1 billion people from the shadow of NTDs. These are diseases of inequity, but are also of solvable injustice. And together, we are solving them. Now, the NNN isn't just a forum. We are a movement. Born in 2009 to tackle diseases like river blindness, trachoma, lymphatic filariasis, leishmaniasis, we have grown into a coalition of 102 NGOs and institutions united by one vision, that is a world free of NTDs. Some might say how? By being the unified voice for NGOs, by sharing knowledge that transforms communities, by staying rooted in our values through participation, creativity, and independence. Because when you empower frontline heroes, health workers, advocates, the people, you don't just treat diseases, you transform futures. But here's the truth. Now, progress isn't just about scaling up what works. It's about reimagining what is possible. And that's why we are here today. Look around this webinar. See the youthful faces, the young leaders from Tanzania, Kenya, Japan, the WHO. They are disruptors. The ones asking why not? Questions like why not? And what if? They are blending technology with tradition. They are turning policy into power, proving that NTD elimination isn't a distant dream, it is a fight that we can win. And we can win now. So, my friends, let's not call the youth the future. They are already here today. And when we champion youth, we do more than just pass the torch. We light new fires. Fires that burn through apathy, burn through complacency, that ignite systems change, that remind us NTDs thrive in silence. But solidarity is louder, it is stronger. So today, we will all hear from innovators like the One Health Society in Tanzania, GANE in Kenya, and Japan's NTD Youth Organization, visionaries who are rewriting the playbook. But this is not just their moment, it is ours. You and me, your expertise, your questions, your partnership. That's how we turn today's ideas into tomorrow's impact. So let's get to work. Let's listen. Let's learn. Let's remember. The road to eliminating NTDs isn't paved by any one group. It is built by all of us working together. NGOs, the WHO, endemic country governments, communities, and the fearless young leaders that we see today, and others out there who refuse to wait. Together, I believe we will finish what we've started. Together, we will make neglect a word of the past. I thank you very much, and I wish you a wonderful webinar. Thank you.
Great. Thank you so much, Gilbert. We apologize that he couldn't be here in person, but he sends his best wishes. As many of you know, the NNN works through the engagement of our working groups, the cross-cutting groups, the disease-specific groups who are focused on various issues. And the cross-cutting groups in particular, we're looking at the cross-cutting implications across the sector. Over the last year or so, the cross-cutting groups themselves have started to collaborate, recognizing the urgent need to do so. I will now invite Dr. Gabby Lang, Chair of the NNN One Health Working Group, to talk about the joint CCCs. Over to you, Gabby.
Hi, everybody. I just wanted to take a very quick moment to say hello on behalf of all of the cross-cutting groups in the NNN. And as a group, we've decided to work better together across those cross-cutting themes. So we're probably in need of a catchier name, but we've kind of referred to ourselves as the collab for now. And NTDs in the past have often been approached and managed in very vertical disease silos, which individual diseases end up being considered mostly in isolation. But since its inception, the NNN, as that network of NGOs, has been really well positioned to identify common themes that sit across many of the NTDs, and also beyond into other health agendas too. So The cross-cutting groups kind of originally emerged in those key initial cross-cutting areas like WASH, disease management, One Health, conflict humanitarian settings, and in how to ensure sustainable systems. And as things have progressed, we've decided to kind of look even broader again. And so we experimented with a few members moving between the different cross-cutting groups, where we had like crossover of people's interests as well. And we noted really that a lot of these cross-cutting groups were having common themed conversations and facing very similar challenges, especially around things like integration. So we decided to come together as this collab and tackle these common themes in a more kind of systems-based approach, which means that we not only just look at the diseases, but we can also look across sectors too. And I think we can also see this shift in how we approach work within the NTDs towards integration, coordination between efforts, and maybe even One Health system strengthening approach being adopted, I think, more widely, both at the UN agencies and also by many of the funders too. So it's really great to be able to reflect that within the NNN, and I find it a very inspiring space to work in across those themes. So that's why we picked the kind of topic for today's webinar in a collaboration with the WHO's NTD team and Bernadette there. And it's been an absolute pleasure to work with our early career colleagues, both in the One Health group and more broadly with this webinar. But we'd be happy to hear from any of you at any stage of your career, NGO or otherwise, who might be interested in any of those cross-cutting themes or in how we deal with integrated approaches for NTDs. So please do get in touch to carry on that conversation. But otherwise, for now, I shall hand back over to our co-hosts for the rest of today's session. Thanks, guys.
Thank you so much, Gabby, for highlighting the importance of cross-cutting partnerships. Now, it's my honor to introduce Dr. Sose Fall, Director of the WHO Global Program for Neglected Tropical Diseases. Dr. Sose is a global leader in NTD elimination, and you'll be sharing more on why youth and early career professionals are not just the future, but the present of transformative NTD action. Dr. Sose, over to you.
Good morning, Ada. Can you hear me?
Yes, we can.
Good morning, good afternoon. I know some of you are in Asia and it's already afternoon, and it's a great pleasure to join you today. There's this common initiative between NNN and WHO, and it's always a great pleasure for me to, join the youth. I started working with WHO as I was very young, first as a consultant, because I attended one international course organized by WHO. At that time, even if I was not yet recognized in my country, WHO already saw the potential for a young professional to contribute at global level. And I spent years doing that before formally joining WHO. That's why I spent most of my time in WHO investing in capacity building, mentoring the youth, starting with malaria, and after that, health emergencies and outbreak. And right now, many people I have mentored are director in WHO and WHO representative at country level, just to tell you why for me it's really important to invest in the youth, because leadership is not only about people with experience. We need to make sure that the youth with the potential can contribute right now in shaping global health program, including NTDs. And but I have some principle for me to make sure that we are really exercising real leadership in this area, because leadership is not just about title and position, but we need some key attributes and key principles for leadership. And I used to present the principle around the 10 C's. In my communication, you hear some C's. First of all, it's really important to work as a team, in public health. You cannot do anything alone. And the teamwork, I always mention the 3C about coordination, communication, and cohesion. Without that, it's very difficult to build a team. But for me, the first prerequisite for leadership is courage, is another C. Without courage, you cannot do anything, because sometimes you have to take difficult decisions, but that's the right decision. Courage to say yes when it's correct, but courage also to say no when it's not correct. And because knowledge is like a minimum requirement. Everybody can have the knowledge, but to have the courage is important. Having the conviction is another see, and the commitment to do the right things is extremely important. That will help you to be really resilient and apply tenacity. But we are working with communities also. That's why it's important to be, have a certain level of compassion vis-a-vis the community. Community compassion is another thing. And do so, you need humility to be able to really show that compassion to the community. We need to adapt to a real situation, and we need to be, evidence-based oriented. If you are not based on evidence, your decision, you will make wrong decisions some of the time. But we are also working in a complex and challenging environment. Truth is complex and challenging. We need to be able to have a holistic understanding to manage the challenge and complexity, to be able to work across areas. We are talking about cross-cutting areas, but if you don't understand the complexity and the challenges, you will never do that. And beyond knowledge, we need competencies, another thing. Without competence is very difficult also to be a leader. So these are my tendency principle I always presenting to the youth when I talk to them. And again, you need to be courageous. Without courage, you can't do anything. And I'm sure, counting on you with this strong network, the future and the present of NTD are bright. I'm always happy to see all the youth coming from, far away. I remember the first global NTD program invited youth from Japan, from Africa, and from so many other countries and continents. So let's work together to make sure that NTDs will not be neglected in the future. Thank you.
Thank you so much, Dr. Fall. Thank you so much. I think potential is something that jumps out to us very much from what we talked about. And when you talk about youth representation and for youths to be the answer to reshaping the global health problems, we do need the right mentorship and the right guidance. And we are appreciative of all the organizations working for this. We are aware that the chat function, we're still working on the chat function. So if you have any questions, please do type them in the Q&A box while we try and get that up. Over the next half an hour, we'll hear from 4 young leaders and organizations on how they have not only championed youth initiatives, but also found new and innovative ways to do so and truly showcase youth initiatives in NTDs. If you have any questions or comments, as I was talking about for our speakers, please use the Q&A functionality of the webinar to write down your questions. Please indicate if the question is for a particular speaker or just a general comment. I'd also like to encourage our speakers to go into the chat box and answer as many questions on the chat as you're able to. First up, it's my pleasure to invite Noel Awa from GANE, Kenya. Noel is a dedicated advocate for youth representation and for advancing for greater inclusion of digital health and global health. Over to you, Noel.
Thank you, Gabby. Can you hear me?
I think you're slightly breaking up.
Gabby.
Yeah, I think you're breaking up slightly. Not sure if the connection is. Could you try again, please? I think Noel is having a bit of technical problems, but we do have a presentation from Noel and from the GANE Kenya team about their work. Noel is a youth advocate, and they've worked quite a lot surrounding WASH advocacy strategy for development, and also they've worked with the government on engaging different regions for in Kenya for World NTD Day. So if you can move on to the presentation.
So we were founded in September 2024, and we have been able to mobilize close to 90 volunteers across various regions in Kenya. Our volunteers have been at the forefront of impactful initiatives like co-organizing awareness activities during the just concluded World NTD Day. For example, in Rift Valley, we led an awareness event at Egerton University in collaboration with the institution. In Western region, we collaborated with stakeholders to engage students, teachers, and parents on safe wash practices. Through these activities, we identified critical gaps in awareness and wash practices. GANE is also very keen in shaping policy advocacy, and as a result of that, we have joined the Ministry of Health Kenya and the NTD NGO Network in developing the Kenya Wash NTD Advocacy Strategy for 2024-2025. So what are some of our key focus areas? 1. Wash. Then we have policy advocacy. We aim to drive reforms and investments in NTD elimination. Youth empowerment. We aim to equip young leaders with tools to shape policy and community action. And then we have innovation. Now, I know you're wondering what led to the birth of GANE. For the longest time, despite youths being potential agents of change, they have historically been underrepresented in NTD policy discussions and interventions. GANE was therefore established to address this gap by equipping the young advocates with leadership skills to shape NTD policies and interventions. I'll then move straight to our first initiative. So one of our flagship initiatives is the Youth-led World NTD Day activities that aim to strengthen the link between WASH and NTDs. So with the Ministry of Health Kenya being the lead and Speak Up Africa being our funder, we partnered with youth wash parliaments in Bungoma and Kakamega counties. So what were we able to do? We coordinated advocacy events in 3 counties, amplifying NTD wash connections. We launched a structured social media campaign dubbed My NTD River Challenge that engaged over 5,000 people within a period of 8 days. We delivered a formal call to action advocating for increased youth representation in national NTD policies. GANE participated as such a strong partner among the youth groups, and as a result, we have taken a leading role in championing ongoing efforts among the youth groups for better wash. Now, what are some of the lessons that we learned? Youth drive policy change. Yeah, so this was evident from the formal call to action. Community voices matter. Regional mobilization made sure that policy recommendations reflected community realities. Digital engagement works. The NTD River Challenge significantly boosted online advocacy. Now, below are some pictures of us at the national and regional level during World NTD Day. And to my initiative B, that is on youth empowerment. So our youth empowerment initiative equips young leaders with skills and platforms to influence policy and lead community-driven NTD interventions. A critical component of this initiative is the digital health training, which educates young leaders on the importance of WASH in preventing and controlling NTDs. Through interactive expert sessions, participants have been able to gain practical skills to lead local advocacy events. Then we have youth-led regional activities. So the young advocates who took charge of local advocacy events, digital campaigns, and stakeholder engagements within their communities fostered leadership and collaboration skills. So what are some of our successes and future aspirations? The training has laid such a strong foundation for meaningful youth engagement in NTD advocacy, boosting confidence and ownership. As a result, we aim to expand training opportunities, introduce mentorship programs, and blend digital and in-person advocacy for greater impact. So below are some screenshots from some of our work. So this was the NTD 8-Day River Challenge. This was a partnership that we had with Youth Combating NTDs, where we were pushing Kenya to endorse the Kigali Declaration. The two are social media and are screenshots from a few of our social media posts. So they're basically analytics. And this one is our upcoming project that is basically on NTD Youth Ambassador Program. Now, as I wrap up, GANE Kenya is committed to empowering young people as agents of change in NTD elimination. So by fostering leadership, promoting WASH practices, and driving policy advocacy, we are creating sustainable, youth-driven solutions to end NTDs. So that is the end of my presentation. Thank you for your time and attention. I really appreciate. So you can contact us through these, the ones below. So thank you so much.
Thanks, Noel from GANE Kenya, for showing us how youth-led WASH advocacy can drive policy change in Kenya. Just a reminder to continue using the Q&A functionality of the Zoom, and for any questions you have for Noel and other upcoming speakers. Up next, we will hear from Yona Yangaza from One Health Society Tanzania on bridging AMR policy and youth representation. Yona.
Hi everyone, thank you so much for that. And I'm honored to be speaking with you today about the critical role of One Health approach in tackling a neglected tropical disease and antimicrobial resistance. The One Health framework integrates human, animal, and environment health sector, develop a comprehensive solution to these health challenges. By leveraging these approaches, we can help disease surveillance, improve water and sanitation infrastructure, implement effective vector control strategies, and foster the community engagement. I'm looking forward to discuss on how One Health can help us to achieve a sustainable health outcomes and address this pressing issue effectively. I will be using the One Health Societies, the youth-led initiatives that is found in Tanzania. What do you mean when you speak about One Health Societies? This is the registered NGOs founded in 2019 and are committed to influence and implement sustainable development goals and a national action to fighting antimicrobial resistance and neglectable tropical disease through awareness and advocacy, training, capacity building, research and surveillance with One Health approach. As we have been said before that, a One Health approach, this is strategies that implement by using interdisciplinary interchange of One Health, of human health, animal health, and environment aspects. Our vision is to achieve the healthier communities in which global health challenges, antimicrobial resistance, and neglectable tropical disease are sustainable, mitigated, and contained. That was about our vision, and the mission is to conduct impactful training, advocacy, community engagement, and research and surveillance, influence a social behavioral change in the fighting against health challenges, specifically neglected tropical disease and microbial resistance. Our activities is ranging from the raising awareness from the community level to the high level advocacies. But on this space, I'll be speaking about how the One Health Societies has integrated high level advocates by using the Tanzanian or founding the Tanzanian Parliamentary Alliance on One Health approach on antimicrobial resistance and neglected tropical disease. So the first activities we do in One Health Societies is raising awareness through campaign and the community engagement, high-level advocacy, capacity building on university students, on NTDs and IMOALA, stigma reduction through storytelling, and joining council to advocate for the resource location. Tanzanian Parliamentary Alliance for the One Health in fighting antimicrobial resistance and NTDs. Is the pioneering initiatives in Africa established to combat antimicrobial resistance and neglectable tropical disease through the One Health approach. This alliance aims to mobilize policy makers to address antimicrobial resistance by promoting coordinated policy action, enhancing infectious prevention, and supporting a sustainable health practice. The alliance also advocates for the improved water, sanitation, and hygiene, that is WASH, a service in health facilities, recognize their critical role in reducing infectious and the misuse of antimicrobials. By integrating human, animal, and environmental health sectors, Tanzania seeks to create a healthier and more resilient nation through using One Health approach. That is what we do for the Tanzanian Parliamentary Alliance. Yes, on this youth success story that I will be speaking on Moral Malchel Days of Action. Is an initiative organized by One History Society to honor the legacy of Dr. Mwale Ntuli Malchel as a renowned Tanzanian scientist and leaders in fighting against NTDs. This event aims to raise awareness about the NTD through the community engagement activities such as walkathon. It emphasized the importance of continuing effort in disease prevention and health promotion, aligning with Dr. Mwale's vision for the healthier future. This event also highlighted the needs for the sustained action against NTDs and reflects Dr. Mwale's contribution to the global health. But despite the fact that the youth are the key in fighting NTDs, but they have faced many challenges that are the limited resources and inadequate platform for the meaning participation. So, and we have been brainstorming that how can we overcome those challenges is mostly through collaboration with the NGOs and the international organization, leveraging mentorship program and the networking and the partnership with local leaders to break the cultural. As we approach the critical juncture in our fighting against NTDs, it's a time for the youth and the stakeholders to take center stage in eliminating the effort. As I have elaborated that, here are the way on how the youth and the stakeholders can be part of these initiatives in ending NTDs. That get involved in a global NTDs campaign and use digital platform to mobilize peers. But on our stakeholders, they invest in youth-led initiatives and they create a space for the youth in decision making. That are the a decision on youth and the stakeholders where everyone can suit to make sure that we are reaching the target by 2030. Thank you so much for listening me.
Great. Thank you so much, Yona. Some of the initiatives led by the One Health Society in Tanzania could be excellent case studies for the rest of us to learn a lot from. And I'm sure there are a few questions that our audiences might have for yourself. So please do keep a lookout on the Q&A box. And also to our audiences, please do use the Q&A function in the chat if you have any questions or comments for any of our speakers. We'll also be talking more about the efforts of the organizations to present today in the coming up panel session. Up next, I'd like to introduce and invite someone who I personally admire and believe that they're doing some amazing work in Japan. Mr. Yuya Kondo represents the NTDs Youth Organization in Japan, who, among other things, are strong advocates and have been successful in increasing the support and commitment of the Japanese government to NTDs, despite not having NTDs in Japan. Over to you, Yuya.
Now, I would like to begin the presentation from the NTDs Youth Organization in Japan. My name is Yuya Kondo. I'm a board member of this organization. I really appreciate this wonderful opportunity. To begin, here's an overview of our organization. It was established in April 2023 and incorporated as an NGO in October of the same year. We are based in Japan, and as of March, we have 50 members. Our objective is to contribute to NTDs by leveraging the power of youth and collaborating with partners from industry, government, academia, and civil society. Our vision is Illuminate the Neglected, and the mission consists of 3 key goals as shown. We initially started with a project to document Japan's history of rabies eradication. At that time, we were a small group of 3 medical students. In April 2023, we were selected for the Reach Out project, and with their support, we officially launched as NTDs Youth Organization. Just 6 months later, we incorporated as an NGO and have since been engaged in advocacy activities. Our organization is divided into 3 main departments: advocacy, contest, and study tour departments. Today, I will go into more detail about the advocacy and the contest department. First, the advocacy department. We have made several policy proposals regarding NTDs to numerous decision makers, including the Minister of Health, Labor and Welfare, and the State Minister of Finance. Of course, we didn't start by approaching such high-level officials right away. Initially, we began by approaching Diet members with a medical background, such as doctors and nurses, who had a strong understanding of NTDs. By building trust with them, we were able to secure more opportunities for further proposals. We worked to build a connection by highlighting examples of Japanese colleagues, such as Eisai, a Japanese pharmacy company, providing free LF treatment. In addition to our individual policy proposals, we have also focused on building a strong relationships with the NTD's parliamentary group. We made sure to highlight the importance of collaborating with the next young generation in their proposal to the minister. In addition to government officials, we collaborate with a wide range of NTDs champions. This photo was taken when we invited leaders from Pacific countries such as PNG and Vanuatu. We were able to have very meaningful discussions about NTDs here in Japan. One of our strengths is a close collaboration we have with domestic partners involved in NTDs. We have connections across all sectors, including pharmacy companies, the GHIFN, educational institutions like universities, and government agencies. Next, the contest department. Just like with advocacy, raising awareness of NTDs among the Japanese public is equally important. We have targeted young people with strong outreach capabilities and have hosted the NTDs contest twice so far. This contest has provided an excellent opportunity for young people to learn about NTDs and present their ideas and proposals. This contest is also organized in collaboration with all sectors. We took the lead planning and organizing contest. We received support from ministries too. One category requires entries to be in video format. The video covers a wide range of formats, including presentations, plays, and musical works. Combined with their social media outreach, we were able to reach a very large audiences. This slide summarizes the results of our activities so far. Through our advocacy efforts and raising awareness initiatives, we have achieved significant outcomes. Specifically, we have contributed to a 125% increase in Japan's NTDs related budget. And we have engaged with over 50 decision makers. By appearing in many media outlets, we have also contributed to raising awareness of NTDs. Additionally, the contest videos have surpassed 10,000 views and reached 2,500 people. Finally, I would like to share our key learnings. The first lesson is not to overlook small collaborations and to take the time to build trust. We have had many meetings and exchanges with numerous Diet members and government officials. The more time and effort you invest in these relationships, the stronger they become. It is important not to rush, but to proceed carefully and steadily. The second lesson is the importance of creating opportunities for citizens to learn about NTDs. Since NTDs are relatively rare in Japan, people rarely encounter them in their daily lives. Therefore, it is crucial to target specific groups and continue to propose various initiatives aimed at them. By amplifying their voices, we can also influence policymakers. The final lesson is the importance of continuing to have faith in your own citizens. According to one survey, 75% of Japanese youth are supportive of international cooperation. We must trust in their passion for cooperation and continue engaging with them. That's all from me. Thank you for listening.
Thank you so much, Yoya. Yoya and his team, they've achieved something very remarkable. Despite not having NTDs in Japan, they were able to convince the Japanese government to increase funding for SPEN, and they also created youth internships with policymakers. Up next, I'm excited to introduce a fellow intern at the WHO NTD department, Dr. Richard Saiga. Richard will share what makes a transformative WHO internship, how to navigate these opportunities equitably, and why all of us, regardless of where we are in our careers, have a role to play in NTD elimination. Richard, over to you.
Greetings, everyone. Thank you for being here. My name is Risha. I'm an intern at World Health Organization. It is a great honor to speak here alongside these inspiring youth leaders in NTDs. So today I will be talking about promoting youth action for NTDs. A little bit of disclaimer firsthand. The views and opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of the organization. So let me share a bit about myself. I'm a medical doctor from Indonesia. I used to work in a remote area in eastern Indonesia, just south of Timor Island, close to where Timor-Leste border. During my time there, I encountered many neglected tropical diseases firsthand. I was also on the front line during a rabies outbreak that spread from Timor-Leste to the island where I was based. After completing my contract, I pursued a master's in public health at Imperial College London. While studying, I had the chance to visit WHO, where I met Dr. Daniel Tarantola himself, a key figure in smallpox eradication and co-founder of MSF. And now, I'm very fortunate to be back at WHO, this time as an intern, working on what do I care the most, neglected tropical diseases. Being here at WHO has been a huge privilege. I came with a direct clinical experience, and this internship has allowed me to transition into the global public health space. It's been a hands-on opportunity to apply what I learned during my MPH, from understanding how WHO supports countries with technical guidance to seeing how global health programs are coordinated and communicated. I've also had the chance to join high-level meetings, including the STAG NTDs in December, and most recently the global meetings on skin NTDs, where I learned a lot just by being in a room with such passionate experts and practitioners from around the world. To make the most of our time in WHO, we, the WHO interns, took the initiative to engage with some of the organization's most influential leaders, including Dr. Mike Ryan, Dr. Jeremy Farr, and Dr. Tedros himself. These moments are truly rare, especially early in our careers. The insights they shared were not only inspiring, but also deeply valuable for our growth and understanding of global health leadership. And that brings me to the initiative that led to my invitation to speak today. To mark the World Neglected Tropical Diseases Day on January 30th, we organized an interactive session for WHO interns on NTDs and the One Health approach, following a brief discussion with our supervisor, Dr. Bernadette Abela. Interns came from diverse fields, not just medicine or public health, but also international relations, economics, even communications. The goal was to raise awareness about how One Health matters not only for NTDs, but also across areas of global health. We were honored to have Dr. Ibrahima Sosiafal, the director of the Global NTD program, to join us and share his insights. It was a small step, but a very meaningful one. To close, I'd like to reference a scene from the James Bond film Skyfall, where a young Q says, "Age is no guarantee of efficiencies," and Bond replies, "And youth is no guarantee of innovations." This exchange reminds us what meaningful contributions aren't defined by age. While experience matters, youth brings something equally powerful: energy, adaptability, and fresh perspectives. Internships, like the one I'm currently in, are a valuable platform for young people to build skills, gain exposure, and grow their global health networks. And most importantly, collaboration is key. When young people from different backgrounds and regions come together, we can drive collective action and create real, lasting impact. And that's all for me. Thank you for your attention. Here's my contact. Looking forward to your questions.
Thank you so much, Rashad. It was very encouraging to see your journey, and I'm sure there are more than a few youths in the room, including myself, who feel very inspired. So thank you so much for sharing that with us. We would now like to invite all the speakers to join us for a live panel session. So if you could all turn on your videos and come online, that'd be great. To the audience in question, if you have any questions, please continue to drop them in the Q&A box. I can see there are a few questions there already. So when the speakers have a bit of time, you could go in and have a look at that. That'd be great. Please note that because of the high volume of attendance, we will not be able to facilitate a direct Q&A with the panelists. However, we do hope that you'll be able to reach out to them and talk to them more and learn more about their work. I'll start, and I'll go to Richard first. Richard, your journey was very, very inspiring to see. What should we be doing to empower youths and early careers, to allow their input on design and implementation of sustainable action? So not just being, being a part, but also being a part of planning and actually implementing those ideas.
Okay. Well, thank you for your question, Subin. So can you hear me now very clearly?
Yes,
Great.
yes, we can.
Okay. Thank you. About how to involve more youth in the NTD actions and the program implementation. So in my opinion, we must go beyond symbolic representation of youth, but instead involve youth as an active partners in the design, implementation, also evaluation of NTD program. That means not only creating the communication channels between youth and professional, but also actively incorporating and taking account their opinions and knowledge. And that can also bridge intergenerational divides between all generations that are involved and then affected by the neglected tropical diseases. And this in turn will empower the youth and also empower all from all generations to work together and to build more sustainable NTD programs that can actually be impactful. And this can only be, like I said in my presentation, can only be received by collaboration and mutual respect to each other. I think that's what I can say about the topic.
Yeah, great. Thank you so much, Richard. I just, Yona, are you able to hear me? Gotcha. If we just come online, and I think sort of in the same question as I was talking to Richard as well, you sit on the sort of the other side as a leader for the Youth NTD organization that's working very, very locally. How could we get organizations like yourself and youth like yourself more involved in the the planning and the implementation, more towards policy? How could we do that?
Thank you so much, Sobin, for the nice question. Simply because I'm youth and NTD similar upon his societies, I will share a little bit what it should be done for empowering youth more to engage in NTDs. The first issue is to address the challenges that are facing by youth all over the world, but specifically in Africa, which is contributing to almost 40% of NTDs global burden. In statistics show that the African contributing almost 40%. So the first issue that which should be done to make sure that the youth are get involved is the first is to engage themselves in decision-making processes. I really appreciate this through the Prime Minister Office of the United Republic of Tanzania had a section of One Health approach where they involve the youth, the One Health Society to become one of the member for the decision-making process, but also is to support youth-led initiatives. We have various youth-led initiatives that need much support for them to get involved in decision-making and making sure that we have a numerous number of youth who can engage more as what they engage in other global initiative. Thank you so much, Sobin.
I'll be taking over from Subin. Hi, Noel, are you online? Welcome back. I would like to ask, what's one innovation you would like to see in the NTD section, in the NTD sector, rather? Hi, Noel.
Thank you so much, Ade.
Okay.
Hi, can you hear me?
Yes. Welcome back.
Thank you. So basically, I'm just going to relate this to the current situation in Kenya. So currently, we have an outbreak of but leishmaniasis, that is the visceral leishmaniasis, commonly known as the Kala-Azar. Now, the problem at hand is that there are very many fatalities, as we all know. Visceral leishmaniasis is one of the most fatal NTDs. Now, there are very many fatalities at the moment, and the reason being is by the moment these people are realizing this disease, it's very late, and then that means that containing the disease is very, very hard. Now, one innovative idea, or rather approach, that I would love to see in the NTD space is if we come up with a mobile-based application, basically where the community health workers are able to report, or rather to detect, these diseases at an early stage. So that is the application could have maybe AI-powered features, basically now when it comes to environmental factors, where if there's changes in environmental factors, especially now in regard to NTDs that can predispose people to those diseases, they're able to detect this. Because if this happens, or rather if this was the case in Kenya right now, we wouldn't be having very many fatalities of people dying from diseases that can be prevented. So that is one innovative idea, or rather approach, that I'd love to see in the NTD space. Thank you, Adeze.
Great, thank you so much, Noel. Very well said. Yue, if I could come to you and also talk about the current status of the sector. And with the decreasing funding cuts, with problems across the sector, how do we continue to make progress on NTDs in the face of decreased international funding? Yuya, what do you think?
Thank you for the question. Can you hear me now? Can you hear me? Okay, thank you.
Yes.
That's a really timely and important question, I think. Everybody in the world is caring about the face of decreased international funding. And also we're facing similar discussion in Japan as well. And I think to keep pushing forward with NTD elimination, we need to make results more visible. I mean, since it's not always easy to show direct financial returns by initiatives, we have to define our own success metrics. Recently, the launch of Triple I has started efforts to visualize the impact of investments, and I think we need to follow that trend. We should present the outcomes of our initiatives in a way that convinces investors that their contributions are making tangible impact, I think.
Great, thank you so much, Yuya. Ada, over to you.
Okay, I'm calling on Richard to tell me his opinion about what do you think the future looks like for NTD interventions.
Okay. Is that all the question? Thank you, Ada, for the question. So
Yeah.
the future is it's a very dynamic situation at the moment, and as we can see, we are facing very rapid technological disruptions. They're happening not in the decades or years, but in months, even weeks. So in this very dynamic situation, youth are actually not only a passenger in this very transformational change, but a key driver, and also the one who actually can navigate through all these changes, because they are digital native, already living in digital age since very young age. So we have to incorporate youth, and in the term of the future anti-intervention, we have to involve young people, youth, to actually participate in the program itself. For example, and in creative communication, we know that there's a lot of media social, and there's a lot of cultural lingo that can only be understood by young generations and not really relatable to older people or more senior people. But if we can collaborate, and then we can communicate this to involve and to make youth more meaningful participation in this initiative and NTD programs, we can bridge this communication and increase the coverage and increase the awareness in all generations, especially young people who are actually disproportionately affected by many of the NTDs. And also digital health innovations, and is also one of the key development that has been growing in the past years or decades, and using artificial intelligence, geographic informational systems, and many other incorporation of technology can actually help in devising and make more effective NTD programs that can be spearheaded by youth, and also we involve them in the ongoing projects or programs. So, and we also not neglecting the issue of climate change, which also directly correlated to the NTD program. So yeah, I think we have to like really be aware of the situation and incorporate youth at all levels of programs. Thank you. Sorry for being
Great.
too much.
Thank you so much. No worries. Thank you so much. Very rightly put up first points. And I think with the development of the social media and communication tools, innovation probably stands out as the future of NTDs. Noel, if I could just come back to you again. One of the problems that youth probably across the sector face is, they have got a brilliant idea or they've got a good idea, and they struggle to put it into practice. What has been the greatest challenges for yourself and for GANE Kenya in terms of implementing your ideas and achieving impact?
Okay, thank you so much, Subin. So basically, I'll talk about matters to do with competing health priorities. So that is to mean that the people tend to give more priority on other high-profile diseases, like maybe I could talk about malaria or HIV. Now, in that regard, that means that as people dealing with NTDs, the focus is shifted towards the other side. And when the focus is shifted towards the other side, that means that the funding also that comes, or rather even the support that comes in the fight against NTDs is very, very minimal. So as GANE, we have received such kind of challenges because you find that while even right now, I just talked about there being an outbreak of bacterial leishmaniasis in Kenya, but still, despite having very many fatalities, you find that the focus, or rather, is not so much into that disease. So that is such a huge gap for us, especially. And I think if we could now focus on policies, basically, that will just shift that so that despite them being neglected, that being the idea that they're neglected, we really need to give focus on these diseases. And if we have the focus, the general focus, basically, then basically the funding, we also have funding that will help us implement these diseases, implement the intervention in diseases. Thank you.
Okay, thank you so much, Noel, for your for elaborating more on the issues and challenges we face in implementing NTD ideas. Up next, I would like to, for the last question, I would like to ask Yuya, if he's online. How do we continue to make progress on NTD in the face of decreased national funding?
I think I talked about the question, did I?
No, I think
Okay,
and the point here in this one is how do we keep working and how can we try and achieve more, like
see.
people to talk to you, because in your presentation you're talking about the power of small connections with and how do we go about doing that and what has been your learning?
Oh, okay, thank you. I think there are many collaboration we made with all sectors in Japan, but we still have some problems and struggle making progress with other people. So I think I'd like to highlight two key groups. First, we need experts who can quantify impact. This ties back to the previous point about making results visible I talked. And we need maybe professionals who can work with mathematical or economical analysis and other data-driven approaches. But more importantly, they need to understand the core objective of NTD interventions and align for their findings with what investors and stakeholders care about. And the second thing that is really important, and we should focus on engaging the next generation of youth, which is middle and high school students. Even though we call ourselves youth, but we will eventually graduate, take on new jobs, and move on to different phases of life. So if we want this movement to be sustainable, we, the current youth, need to actively nurture and inspire the next wave of young leaders, I think. Is this my answer? Yeah, thank you.
Great, thank you so much, Yuya. Thank you to everyone for taking the time to answer the questions. It has been really great to be a part of this conversation. And I think as part of my own experience at the Dr. Mission, youth could be the answer to talking more about NTDs, to doing more, but we do need the right mentorship. And I think something that has really worked for myself is having spaces where I can go and fail, bring up new ideas and then learn from those failures and then just keep going on. So it is near time for our webinar, and I would like to thank everyone for joining us this morning, afternoon, or evening. My sincere thanks to Dr. Sose and Dr. Bernadette from the WHO NTD department for your support and collaboration. And of course, to all of our panelists and speakers for today, my co-host Ada, and to Dr. Gabby for bringing all of us together and making this happen. If you'd like to learn more about the NNN, join us as a member or join the cross-cutting groups as a member, you can reach out to the respective chairs of the working groups, which is all listed on the website. Or you can send an email to info@ntdnetwork.org. You can also find more information on all of the working groups, as I was saying, on our website. And if you want to join any one of those, I'm sure we'd love to chat with you. Thank you so much for joining us today. And I would like to hand over to Ada to see us out for the day. Thank you so much.
Thank you, Subin. Thanks, everyone, for this vibrant discussion. Thanks for your participation in this webinar. And a special thank you to Dr. Sose, Dr. Bernadette, Dr. Gabby, Dr. Gilbert, and our incredible panelists. To our attendees, let's keep championing youth innovation because health equity starts with inclusion. Thanks so much for attending this webinar, and bye-bye.
Thank you so much. Bye-bye.